for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, July 21st, 2020. We're going to be joined with Dr. Fernando Bayron. He's a general and bariatric surgeon with Tenet Florida Physician Services, and the website drfernandobayron.com is where you can find more info. His number is 954-472-1322. He's on staff at Florida Medical Center at campus of North Shore, located in Fort Lauderdale, and bilingual in English and Spanish. So we are waiting for him to connect with us. Been doing this show for a little while now, and we're doing the best we can with making the connection. So I'm waiting for him to come on to the program. Oh, great. Thank you. Dr. Bayron, thank you for joining us. How are you doing this evening?
Good, David. Happy to be here with you. I'm still trying to log in on the computer, but I will keep trying to see if we can see each other.
Okay, well, we can still do the interview. We're here on the radio, and we want to learn a lot about the general and bariatric surgery that you provide. So let's get right into it. You're the leader in robotic-assisted surgery cases for all of Tenet Healthcare, which that's just an amazing feat.
Hello, David.
I heard that.
Hello.
Oh, go ahead. So, Dr. Bayron, you're the leader in robotic-assisted surgery cases for all of Tenet Healthcare, which is an amazing feat. Can you share with us when you started doing robotic surgery and what type of ailments you can provide treatment for robotically? I think we may have lost Dr. Bayron there. So, like I said, we're going to be joined with Dr. Fernando Bayron, general and bariatric surgeon. Hi, Dr. Bayron. We have you loud and clear. How you doing?
Here. I'm sorry I cannot log in. I will keep trying.
Hey, Dr. Bayron, I can hear you loud and clear. We can do the interview right here. Can you hear me? Dr. Bayron, are you able to hear me?
Yeah.
Hey, Doctor. All right, great. We have you. We have a great connection now. Sorry about the connection over the video. We'll get you back on and do it that way again. Let's do the interview now, though. So I was just telling the listeners, you are the leader in robotic-assisted surgery cases for all of Tenet Healthcare, which is an amazing feat. Can you share with us when you started doing robotic surgery and how many cases you're at now?
Yes. So I started doing robotic about 5 years ago. And basically, when I saw that technological advance and opportunity, I decided to jump into it, and I became a fully robotic surgeon. I do mostly everything that is intra-abdominal surgery robotically. And as of now, we're close to doing 2,000. We'll be doing 2,000 cases in the next 2 weeks.
That's amazing. 2,000 cases, and you've done all these at Florida Medical Center, a campus of North Shore located in Fort Lauderdale.
Well, to be totally honest to you, I've done like 3 cases in other places. But in Florida Medical Center, we have the best technology. Even more important than that, we've trained our team so well that it just makes my life easier to do them there because we have the best team. I've tried other places that they just don't compare.
Oh, that's great news. And so tell us a little bit about how robotic assisted surgery works, because if someone hasn't seen the procedure or learned about it, they may think that the robot's actually doing the surgery, but it's right there in the name. It's robotically assisted surgery. So tell us how the surgery procedure works and how it helps you as a physician and the patient as well.
Well, yes, that is a very common question I get from my patients. They get concerned and they say that frequently, are you not doing the surgery? Is it a robot? The truth is that, as you well say, it's robotic assisted. The robot, in reality, is an instrument that we use to do the case. Basically, the robot is like an interface between the surgeon and the patient. The instruments are placed into the patient by the surgeon, who connects the instruments then to the robotic arms that are controlled by the surgeon from a console. And what does it benefit the patient and the surgeon is that since there is a robotic interface, basically there is a computer between the surgeon's eyes and hands and the patient. The computer gives us the technology to correct all the human failures that we may have, like tremors in our hands. We increase our visualization. We have augmented reality, the contrast and the colors and the organs are seen better and easier. So that makes the surgery easier for me. But if the patient is receiving a surgery and he knows that the surgeon is working with better visualization and better movements, he can imagine how many benefits will the patient get in terms of less complication, less bleeding, and faster recovery.
That's great news. We're here with Dr. Fernando Bayron, general and bariatric surgeon with Tenet Florida Physician Services. His website is drfernandobayron.com. You just put in your browser there, your web browser there, drfernandobayron.com. That's BAYRON. His number is 954-472-1322. He's on staff at Florida Medical Center, a campus in North Shore, located in Fort Lauderdale, and his office is right there on the campus of the hospital. Dr. Bayron is bilingual in English and Spanish. Yes, Dr. Bayron, you were telling us about, some of the benefits of robotic surgery, and, it's great not only for the patient with, shorter hospital stay, quicker recovery time, but also it can be helpful for the doctor themselves because it takes a lot of strenuous activity. A lot of people don't realize if they haven't seen a surgery, it can be very strenuous on the physician. So it's actually making you a better doctor by, saving, some of what would wear you down, correct?
Yes, and that's a big advantage to us. People don't realize because in reality, the public, the patients don't see what is happening in the surgical suite, but surgery is very strenuous on the body of the doctor. And many doctors end up having shoulder issues, neck issues, back issues because of the positions that we have to do. Sometimes we stand next to a patient for 2 or 3 hours in a position that is totally non-ergonomic with our back bends. The robot allows us to get better access to the patient while still sitting comfortably on a chair. And at the end of the day, that allows us to work for more years.
Now, as a general and bariatric surgeon, can you list some of the surgeries you can do robotically with this, robotically assisted surgery?
Yes, I do basically everything that is done intra-abdominally. So in general surgery, we do gallbladder, we do any kind of surgery of the bowels. It may be for cancer or for benign diseases like appendix or diverticulitis. A big a big number of cases we do is hernias. Hernias is very important component of our practice. And going to bariatrics, we can do all kind of bariatric surgery. Is particularly useful for those people that had bariatric surgery before and need to have what we call a revision, like a second surgery to make them to continue losing weight. The robotic procedure is very appropriate in that situation. And now that you mentioned that at Florida Medical Center, we're one of the few centers in the state that is double certified as a center of excellence in both robotic and bariatric surgery.
That's great as well. You have Florida Medical Center, a campus in North Shore located in Fort Lauderdale. Dr. Bayron's office is right there on the campus of the hospital as well. 954-472-1322 or drfernandobayron.com. You can find info on, all of the specialized robotic assisted surgery that he does, general and bariatric surgery. Everything's listed there as well. Dr. Bayron, I'm glad you mentioned, an appendectomy, for appendicitis, that can be robotically, because you recently provided emergent care, general surgery care for a woman who had acute appendicitis. She came to the hospital during the COVID-19 pandemic, so recently, and she came luckily before her appendix burst, and you were able to perform an appendectomy. Can you tell us a little bit about, signs and symptoms of, an appendix issue, and then how you performed the appendectomy?
Yes, so appendicitis is one of the most common emergent procedures that we do. And appendicitis usually is characterized by the patient complaining of a pain that usually starts in the epigastrium. The epigastrium is like the top of the stomach, by the stomach itself. And then after a few hours, the pain moves down to the right flank or the right side, the right lower abdomen. Usually is accompanied by things like nausea, vomit, fever, general malaise, and it's an acute process. It doesn't take a month or 2 months to develop. It usually evolves over a few hours, less than 1 day in most cases. The treatment for appendicitis is surgical, always needs to be operated. We do what we do is we remove the appendix. That is a little segment of bowel at the beginning of the colon. And we can do, traditionally, it was done by opening the patients and doing open surgery. From there, it evolved to us doing it laparoscopic with the laparoscope. And that's perhaps the most common way of doing it nowadays, but it can be a challenging procedure, especially if the patient is overweight or is too big. Last year, I started doing them robotically, and not many people do them robotically in the community because they have the idea and the perception that it takes longer and it's more complicated. And in fact, we are about to publish in the medical literature our experience demonstrating that we can do the appendectomies with the robot far more efficient, more cost efficient, cheaper for the hospital and the system, and that the patients are discharged in less time and using less pain medications, less narcotics, no narcotics actually.
That's a great explanation, and thank you for explaining you can do it robotically now and why now. I also, it's important that this woman also, knew her signs and symptoms and knew to go to, a hospital or call 911 because if the appendix had burst, it could have been obviously, a very, a different outcome. So what can you share with people who may have a fear of going to a doctor's office or the hospital for care right now? Obviously we're in this COVID-19 pandemic, but, elective surgeries have resumed. What can you tell people who may have that fear and why it's so important if something like, an appendix issue to, go to the hospital or call 911?
Well, we need to understand that being concerned about COVID-19 nowadays is real. I mean, people need to be concerned, but they need to understand that in our hospitals, for that matter, in all hospitals, the healthcare professionals are prepared to deal with it, and they know how to do their things. They know how to use the appropriate protection equipment and protocols. And I don't really see it as risky to go to a hospital. In fact, as I was telling my wife today, we were talking about that, I feel safer going to the hospital than going to a restaurant because I know that everybody that is there knows what they're doing, and my risk of getting contaminated there is minimal because we're taking all the appropriate steps. And there are conditions like appendicitis that they just can't wait. They need to be treated.
Yeah, that's important. We're here with Dr. Fernando Bayron, general and bariatric surgeon with Tenet Florida Physicians. The website, drfernandobayron.com. There's all of his information there. That's drfernandobayron.com, Bayron. Dr. Bayron's number is 954-472-1322. And as we learned, he's on staff at Florida Medical Center at campus in North Shore, located in Fort Lauderdale. Mm-hmm. His office is also on the campus of the hospital. He's bilingual in English and Spanish. Dr. Bayron, you mentioned, that you also perform bariatric surgery. What types of bariatric surgery do you offer?
Well, I offer all kinds of bariatric surgery. The most common bariatric surgery that we do nowadays is the gastric sleeve. The gastric sleeve is kind of the standard of care now. It provides for good weight loss, minimal recuperation after the surgery, and very few side effects over time. The other surgery we perform is the gastric bypass that is a little bit more aggressive, a very good surgical procedure. We can do it very safely with the robot, and it's a very common operation. It's very important to mention, David, that many people are not aware that after they have a gastric bypass or a gastric sleeve, there may be situations where, because of the medical issues that they may have, they may regain weight. And there are some people that are candidates to have what we call revisions. Revisions is doing a new surgical procedure of somebody who already had a previous bariatric procedure, and in many cases we're able to help them regain their path to weight loss by doing additional procedures, by revising the original procedure.
Yeah, so you also offer revisional bariatric surgery, gastric sleeve, and gastric bypass. Who is a candidate for gastric sleeve and gastric bypass surgery? Let's start there. Who is a candidate for gastric sleeve and gastric bypass?
Well, the who is a candidate for bariatric surgery is defined by the government, by the NIH, and basically is somebody who weighs more than, we measure something that is called the BMI, the body mass index, and that is a calculation we make where we consider how much you weigh versus how tall you are. So the ideal body weight is a BMI of 20. So we consider candidates whoever has a BMI of 35 or 40. So in real life, what that means is that you weigh about twice what you should be weighing. And it is especially important to address that if you have any comorbidity or any other disease that we think that can be made better by losing weight, like, for example, diabetes, high blood pressure, people with orthopedic issues is a very big source of patients for us, people that need replacement, hip replacements, that kind of issues.
That's great as well. We're here with Dr. Fernando Bayron. If you want more information, it's drfernandobayron.com, 954-472-1322. He's mentioned some of the general surgeries he does robotically, and as well as bariatric surgery. Well, Dr. Bayron, it's hard to believe we're out of time, but I'd like to have you on again in the near future. And thank you for joining us and giving us all the information on the general and bariatric surgery care you provide. We really appreciate it.
Well, as always, David, it's a pleasure. Anytime you want, let's see if we can make the connection happen next time, so we can see each other.
We'll definitely do. We'll have you on in the near future. Again, we'll see you next time on the You and Your Doctor show.
Thank you, David.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.